Hello and welcome to Wilson Center Now, a production of the Woodrow Wilson International Center for Scholars. I'm John Molesky. Our guests today are Rui Zhong and Alex Long. Rui is a program associate with the Kissinger Institute on China and the United States, and Alex is a program associate with the Science and Technology Innovation Program. They join us today to discuss the coronavirus outbreak. Alex and Rui, welcome. Thank you for joining us.
Thank you for having us.
Thanks.
So at some point, they're going to name this thing something other than the coronavirus. But could you explain on the science level the notion of what a coronavirus is and why that's not an appropriate, distinct name for this outbreak?
Absolutely. So coronavirus is more like a classification of viruses. There's about 6 that are common knowledge, 2 of them being SARS and MERS, which are also getting a lot of attention right now, and 4 other strains that kind of are like the common cold and just go around in the human in the world today. But the 7th one now would be this new coronavirus, or NCOV, novel coronavirus, which again you said they have not named yet.
Yeah, it's coming soon, a more distinct name. And so we're at the, things are moving fast. So by the time we record this interview and the world gets to see it, some of what we talk about may change. But at this stage, we're at a global emergency, but not yet a pandemic. Is that correct?
Right, because a pandemic would mean that it was an epidemic in more than just mainland China.
Got it. So, Rui, could you give us the update in China? We know that the numbers keep growing exponentially daily.
Right. We're seeing a lot of confirmed cases as well as deaths being added. The majority of cases being concentrated in Hubei province, which my family is from, in the city of Wuhan, and I believe Huanggang, which is a city near Wuhan. There's also been cases reported in Wenzhou, which is a city that is a big manufacturing hub for China.
Is your family still in Wuhan, Rui?
Yes.
Have you been in touch?
Mm-hmm.
And how are they doing?
So right now, since January 23rd, the city of Wuhan has been in a quarantine in which people were encouraged to stay indoors and not travel and be extremely cautious when moving about in public spaces. And so right now people are mostly staying indoors, helping them and their neighbors get fresh produce. The timing of the coronavirus is hit at about a time when a lot of people had stockpiled food for Chinese New Year, which was when a lot of grocery stores were closed. But this is not something that can be sustained indefinitely.
But also at a time where people were going to do some traveling and some visiting and had to cancel a lot.
One big criticism of the Wuhan government and Hubei government more broadly was that the quarantine was imposed at a point of time where it was too late and people had already started traveling for Year of the Rat festivities.
And incubation period 2 weeks before you show symptoms. So
yeah, but you can still spread it within those 2 weeks potentially.
Yeah.
Okay.
So what happened was people started traveling for New Year's, and now some of the issues that those travelers have run into is a widespread panic over people that might transmit the coronavirus. So you have manhunts across China, I would even use the word, for people who have traveled or from Hubei to find them and get them into quarantine zones or even just kicked out of some towns and villages. So there's a serious risk of managing stigma of people that have been traveling out of Hubei since 23rd.
You mentioned SARS earlier, Alex, and one of the most difficult things to do in these matters is to do accurate threat assessment. We tend to panic when it's something new.
Yeah.
Could you put this in some sort of context for us, maybe comparing to SARS or maybe to the average flu season in the United States?
Yeah, so that's a very good question, and something that is tremendously interesting about this virus, because it is acting like SARS in the fact that it is a coronavirus, so it has a lot of the same markers, like a spiked structure, but it is spreading much more rapidly than SARS did. So to put in perspective, SARS infected around 8,000 people, It also had a much higher fatality rate. And right now, we know that the novel coronavirus has infected, it's approaching 25,000 as of today.
Is that total worldwide?
Yes, 25,000 total
Okay.
worldwide. And then only about 2% of those have proved fatal. But I really want to caution that number because, like you said earlier, things are changing every single day. And one of the greatest, at least misnomers and misnumbers in this is that infection number because of what we've already talked about with the 2-week incubation period where people could be spreading symptoms or spreading the disease without being symptomatic. They might not have been classified or diagnosed as having the virus. So current epidemiological models are actually saying that there's probably 75,000 to 100,000 people who are actually infected.
And people who are confirmed who may not recover.
Exactly.
They're not fatalities.
Yeah,
yet.
exactly.
It's a dark thought, but the reality is
Right.
that it could go that way. There's a psychology to this, right? And none of us are psychologists, but the government has to deal with that, the perceptions part. How has the Chinese government done from the beginning of this epidemic to where we are today?
I want to single out the Hubei government and the Wuhan municipal government specifically because they are alleged to have sat on the news of a possible infection that had been circling around since December and went ahead with pre-planned New Year's festivities. And one thing that's been really angering a lot of critics within Hubei have been the fact that people that initially spread reports of the infectious disease were all doctors. They were disciplined by the government for spreading rumors, and then it turned out they were medical professionals. So in terms of
And they weren't rumors.
No, they were not rumors,
They're
as we can
facts.
see now. But what this has done for the perception of regional government is that they are now handling a situation where there's a lot of resource scarcities. And I would say that the resource scarcity is doing just as much harm as the disease itself within Hubei province and other hard-hit provinces in China.
There's a certain thread the needle aspect to this. Then you go beyond China and look at the reaction globally, and you see some suggestions of a little too slow to close the borders or take other precautions, and in other cases, accusations that people are panicking and going too far. What does the global health community say?
Yeah, so on I think it was the 27th, the WHO declared a fake, which is a public health emergency of international concern. And, or that was the 30th, they declared a fake. And that basically gave the WHO the ability to start issuing these recommendations. And one of the things that they said when they issued this fake was they discouraged the banning of travel or trade because actually banning travel hinders the process. And like Ray already said about the resource management, it's hard to get things in and get things out, just resource-wise when there's a travel ban. And then also when it comes to people moving in between places, it discourages health professionals from going to the places most in need, and because for fear of no reentry. And the real reason why they declared a fake, the WHO, was to help the low to middle income countries who are going to need more resources, both in funding and just intangibles, as this virus potentially spreads throughout the world.
What do we know about its origins?
That's also a murky territory. It's thought to be, it's zoonotic in origin, which means that it comes from an animal host. And it's thought to have gone from a bat to an intermediate host to humans. They did this through sequencing the RNA, which happened at a rapid speed, almost unheard of, on January 7th. And they were able to post the genetic code online, and people were able to sequence it and find out that it was 96% coming from a bat origin. But the idea of how these coronaviruses usually spread is through another host, potentially at the Wuhan seafood market, though there are other reports saying that there were a lot of cases not connected to that market. So zeroing in just on that one place, yes, there was a critical mass of people there who did show that they had infection, but there are other people around the time earlier than when we all were starting to get news about it who don't have a necessary connection to that market.
It does raise the question of regulating the food supply in China, and what can we expect as the fallout from this to be in that regard. Talk about bats or whatever it might be, not traditional items in a market. And I guess some of the animals we're talking about were live as well.
Yes, and SARS actually came from a bat to a civet cat and then to human. So other animals that could be potentially at these live markets could be poultry or other mammals.
Mm-hmm.
Well, I would add to Alex's previous point that another key piece of information that was withheld by government officials was they also sat on the information that the disease could be spread from human to human. This was not something that they were originally circulating, and by the time...
Do we know that they knew it at the time and were covering it up intentionally?
I believe Chinese investigative reporting, which is had an unusual period of openness, were uncovering the cover-ups that the government had made in December. As for food sources, this is something of a controversial issue, I think, most because at the scale that the new coronavirus is spreading, the issue isn't just eating certain types of wildlife or not, but but public gatherings. There are only so many people that choose to eat those types of food items, but there are far more people that would gather
are in proximity to those people.
Right. And once they're out and about and traveling throughout the country, it doesn't matter what you eat. It's whether or not you're in the same space as somebody that had spread the virus.
Yeah. So, Alex, and when we were first discussing conducting this interview, you mentioned this One Health initiative. Can you talk about what that is for people who don't know? And I was one of those until you told me about it, and how it factors into the larger questions that we're exploring.
Yeah, absolutely. And I'd be super happy to. So One Health is a framework that's being understood by the public health community. And it basically asks the world, policymakers, and just the public to never view a disease in a vacuum. So it's never just a human problem, it's never just an animal problem, and it's never just an environmental problem. It's all three at once. So it creates a sort of triad where when you're discussing global health matters such as this, the interplay between animals and humans and their environment is critical to actually understanding the origin. So like I said earlier with the bat to human transfer through the intermediate host, that's the example of like a zoonotic event or a zoonosis, which describes an animal to human or human to animal transfer of a virus. And understanding One Health, you can implement different and more proactive policies because it's really focused on pandemic prevention. So it would be putting in stricter regulations on wildlife trade or creating more education and understanding around how to deal with livestock like poultry and pigs, which both are shown as hosts for things like the avian flu and the swine flu. So it's One Health is taking an integrated approach to looking at all diseases and non-communicable as well. That gets into a little bit more of an interesting territory about lived environment and what you're around, but the overarching theme is this framework and making sure that people understand that it's really all connected now that the world's getting smaller in terms of sea levels rising, people living closer together, and then us then living closer to wildlife.
Speaking of the larger issues beyond this moment in history, how does this factor into the bigger story about the rise of China? Is this just a bump in the road, or is this a major test for Xi's leadership?
I think that this is definitely going to be one of the bigger security issues, albeit a non-traditional security issue that is going to test Chinese resources this year. Already we've had PLA medical personnel dispatched to Wuhan, and we've had construction teams begin to build 2 temporary hospital care facilities
If people haven't seen it, I would say those temporary hospital construction. There's video online you could built in 3 days or something.
There
It's amazing to
there've
watch.
actually been people locked inside their houses that have given nicknames to the construction vehicles and are rooting for them on the live stream. So that's what happens when you're stuck inside your house for that long, I guess. But I would also add a caveat to that there wouldn't be a need necessarily for 2 large temporary hospitals or more if there was more information transparency and more of a space for the reporting of initial infection issues back in December by the local officials. Now there's the central government is obviously more involved. Myself and other colleagues in China analysis are not sure to what degree Xi himself is involved in planning and leadership. They've sent the premier Li Keqiang to visit Wuhan, but Xi himself, it feels like we don't see his fingerprints on this as clearly as we've seen other policies in the past.
But ultimately, the buck stops somewhere, and he's the man at the top.
Yes.
That line we talked about between panic and prudence, what can individuals do that's reasonable? What are your family members back in Wuhan doing? What kind of steps can people take?
Well,
you see a lot of video or pictures of people with masks, and I've heard that that's not very effective.
Masks, I think Alex can speak a little more specifically as to the effectiveness of them, but I think having a strong sense of community is something that's socially really important to get my family through this time. My grandfather's medicine, we have somebody that our family knows picking it up for him and dropping it outside their houses, keeping up with reliable, clear information on what you need to do with different household items, with how to maintain effective sanitation practices. And if ultimately, I think having a sense of solidarity within a community that for a long time is going to have this disease associated with them, unfairly, I would say personally, but staying strong and staying together is something that I think is getting the people of Wuhan through this time.
Whatever you can add in this regard, Alex, and also if you would identify what are the best sources for people who are concerned. Does the CDC publish guidelines? Is there any place that individuals can turn?
Yeah, so to circle back on the mask point, masks are more effective at stopping yourself from spreading the disease because it's basically covering your mouth like you would this, rather than if you were to put it on to avoid it from like the particles from infiltrating your airway. But that said, the best way to go about keeping yourself safe is just washing your hands, coughing like this, and understanding that it's flu season and protecting yourself against the flu will also help protect you against anything like this, though I do want to say
that includes getting a flu shot.
For the flu. The flu shot would do nothing for the coronavirus, or at least it hasn't been shown to, or I haven't read that. But I would just say that people should not be worried on their day-to-day life in the U.S. right now that they are interacting with people who have coronavirus, just to kind of quell that panic, because it isn't at that level yet. It could get there, but right now just focus on not getting the flu and doing everything sanitary-wise that you would in the cold season, flu season that we're currently in. And then in terms of information, the New York Times has a great running live, basically like task center where they have great resources. And I was going to say this earlier too, we live in a really interesting point in time where the open data that's being spread and the scientific knowledge that is able to go across country borders is actually incredible. Like when I mentioned earlier about
something
the genomics,
SNP's been very involved in.
Exactly. And one of the things I mentioned earlier about the genomic sequencing that was posted publicly, it's stuff like that that we never had during SARS, and not to this degree. And it's very exciting. But with that comes also the rapid spread of misinformation. So the people that you follow on Twitter, I would truly only take my advice from the global health leaders in the field right now, the people who work at the WHO, the people who work at places like Johns Hopkins or Georgetown, to name two centers for true excellence when it comes to global health security.
So before we close, I'm going to ask each of you if you could. We've bounced back and forth. There are two tracks sort of that are part of what we've been talking about, right? There's the political aspects or the geopolitical aspects, and then there's the science. So as a closing thought, where do we go from here? What happens next? What is the timelines involved? And if we're talking about a potential vaccine or whatever it is that might be in the cards. Alex, if you could begin and address the sort of the science trend line.
Yeah, absolutely. So currently, there are a lot of research institutions around the world who are focusing on trying to develop a vaccine. But with that, especially in terms of U.S. regulation, those probably won't be operational for another year because they're working on creating the vaccine. Then it goes to clinical trials, maybe, hopefully this summer. And then by this time next year, potentially we could have a vaccine, but that's still kind of up.
And would the vaccine treat the virus or inoculate you against the virus?
It would inoculate you against the virus. In terms of treatment, that's very hard with viruses. There's actually people using HIV medication because HIV and coronavirus are both RNA viruses. And there has been shown correlation with at least SARS that these medications that people are using could potentially help, but that's still kind of unconfirmed. So when it comes to antivirals or things that you would treat yourself with right now, they're still very much in the investigative phase, but the vaccine is what I think might be easier for them to actually deliver on. And then in terms of timeline, we are hoping that this disease is similar to the flu in the sense that it basically peters out once it starts to get warmer because the flu virus at least travels pretty well within the dry and cold, but not once it starts warming up again. So there is a possibility where this novel coronavirus has its peak. Well, it's still peaking, but then kind of lulls within the summer months, but there is a chance that it comes back.
As the weather becomes cool again.
Just like the seasonal flu. Yeah. And because it's an RNA virus, it can mutate and create new strains at a rapid rate.
And so what are you looking forward to as far as the trend lines regarding the politics, both within China and beyond?
So if I were to ask you which country outside of China has the most cases of confirmed coronavirus, a lot of Americans would answer, oh, I'm really concerned about America. I'm really concerned about Europe. The answer is Thailand. America itself, as of recent reports, has only confirmed about 11 or so cases of the novel coronavirus. Hubei and itself still takes up the majority of confirmed cases and the majority of deaths. And so I would say that my political conclusions are right now that China is going to be critically monitoring the supply routes and the resource distribution into the sort of epicenter of this virus. And also something that's going to be trickier in the medium to long term is the issue of disinformation, both general disinformation and also potential censorship, because in the medium to long term, China still has its priority of political stability to maintain, and that's going to be its priority with or without a virus.
Well, sure, Alex.
Can I just mention one last
thing?
Of course. And this is a larger takeaway, but I think we are going to see more and more cases of this type of situation as the years go on. And as driven by climate change, driven by globalization, warming and driven by us overpopulating this world. So I'm
glad you brought us to a happy ending.
Yes, I'm sorry.
Your final thought.
I don't tell people that they should worry about coronavirus in the day-to-day on the metro, but I do think that they should worry about it as a sign of what is to come. And the only way that we can actually help this situation is by taking a proactive look at preventing these pandemics in the first place and setting up institutions with more monitoring and cracking down on that wildlife trade and bolstering up low to middle income countries so they're able to create infrastructures that can handle an epidemic. I'm confident in many ways that the U.S. can handle this, but the real problem is, and this is why a fake was declared, is because a lot of other countries may not have the means to both monitor, mitigate, and even like detect when the virus enters their borders. And that is very, very scary.
Well, we'll end on that cautionary note. And I want to thank both of you for providing some analysis and insight of the current situation, but also reminding us, Ray, particularly with your family back in Wuhan, about the human face of this. This isn't just about dispassionate analysis, real people. Real stakes. Thanks again for joining us.
Thanks, John.
Thank you as well. Hope you enjoyed this edition of Wilson Center Now and that you'll join us again for another soon. Until then, for all of us at the Wilson Center, I'm John Molesky. Thanks for being here.